Well, as families prepare to send their kids back into the classroom in a couple of weeks, one item on the back-to-school to-do list may be getting a checkup with your doctor for that child.
Yeah, a lot of people talking about that body mass index during that back-to-school checkup. Should we rely on this? That's the question that Megan Zielinski asked some local experts. Good morning, Megan.
Good morning. Well, Mark Tracy, that body mass index has long time been that standard but a controversial measurement when it comes to weight and overall health. It's a measurement of a person's body fat based on their height and weight. For example, I am 5'10" and about 185 pounds. If I was to put that into this formula up here, I would get my BMI. However, I like pictures better, so I'm going to use this chart here and I just follow across and match my height and weight up where I get my number 26. And as you can see, that is in the yellow, which means my BMI tells me that I am overweight. However, I like to think that I'm pretty healthy, so I spoke to some healthcare professionals to tell me how accurate this body mass index number really is. Body mass index, or BMI, has its shortcomings.
I don't think it's reliable and it doesn't tell the whole story.
Epidemiologist Dr. Becky Dawson tells us that the American Medical Association has officially recognized that BMI cannot be the only determinant of obesity in children.
There's so many other measures and other ways to look at somebody's health, and that we need to think about our health not just being one data point, but our health is so much more.
The American Medical Association suggested that physicians also consider other factors like someone's bone and muscle mass, amount of visceral fat, body adiposity index, the overall percentage of fat, and other genetic factors like abnormal blood sugars or thyroid tests.
As we move into the school year and we all start thinking about back to school physicals, BMI is one kind of data point, and we need a lot more data points to determine whether somebody is obese or not, and whether their obesity is directly impacting their health today, or they're kind of on this path for long-term health effects.
Pediatricians stress the importance of physical exercise for those children trying to maintain a healthy weight.
And the parents can lead by example in doing activities with their kids. But even if it's not organized, something simple, walking around the block, is encouraged.
If you are worried about your child's overall weight, Dr. Burns tells me that having a conversation with your pediatrician or primary care physician is step one. He says this will help the doctor address any underlying conditions that may be leading to your child's overweight or obesity. From the studio, Megan Zielinski, Erie News Now.